So a bit basic about laryngeal cancers. Before that, a little bit of anatomy. So this is epiglottis, this is thyroid cartilage, this is cricoid cartilage, this is arytenoid, corniculate, these are the vocal cords, these are the tracheal rings. And if you see by ideal, it will look something like this. This is base of tongue, this are valvular, this is epiglottis, this is vocal cords, these are aryepiglottic folds, this is arytenoids, these are the tracheal rings that you can see through, this is a piriform fossa. Now classification of laryngeal cancer is basically based on the region. This is the thyroid cartilage, this is the true vocal cords, these are the false vocal cords. Anything above the true vocal cords will be supraglottis, and anything below the true vocal cords will be the subglottis. Okay, and coming to lymphatics of it, supraglottis is richly supplied by lymphatics. Glottis has no vocal cords per se, have no lymphatic supply, and subglottis have few. Coming to supraglottis, it will drain to subdigastric or middle jugular lymphatic chain, and subglottis will drain into pre and paratracheal and inferior jugular lymphatic chain. The basic management is, if it is early glottic cancer, the treatment is radical RT. If it is locally advanced, then we give concurrent CT-RT. If it has bony or cartilage erosion, then total laryngectomy followed by adjuvant CT-RT. Now coming to 2D portals of radiation, the superior border, this is for early glottic cancers. So the superior border will be the thyroid cartilage. The superior border of the thyroid cartilage, inferior border will be the cricoid cartilage, posterior border will be the anterior border of the vertebral bodies, and the anterior border will be 0.5 to 1 centimeter fall off. This will be a 5 into 5 field or 6 into 6 field or 4 into 4 depending on the patient's anatomical size. And if there is supraglottic extension, then the superior border will move to the angle of mandible, and the posterior border will move up to the spinous process of the vertebrae. And if there is subglottic extension, then the tumor, whichever is the lowermost part of the tumor, 2 centimeter 2 centimeter from the lowest part of the tumor will be your inferior border. Your posterior border will be the same spinous processes. Anterior border will be 0.5 to 1 centimeter fall off.